Hi guys, my name is Fatima Goni. I'm a final year student of physiotherapy. I'm on PhysioNet. So if you want to see what I want to discuss, make sure you stick to this video from this moment till the end of this video. So I'm going to be talking about hypertension. I know a lot of people would have heard about it. Some people call it BP. Some people call it high blood pressure. So another name for hypertension is high blood pressure. So it is a long-term medical condition in which the blood pressure in the arteries are persistently elevated. The systolic blood pressure is more than or equal to 140 mmHg, while the diastolic blood pressure is more than or equal to 90 mmHg. So talking about types of hypertension, we have 4 different types of hypertension. So the first one is the prehypertensive stage. This is the stage just before the hypertension begins. So in this stage, the systolic blood pressure ranges from 120 mmHg to 139 mmHg, and then the diastolic blood pressure ranges from 80 to 89 mmHg. So the second type is the hypertensive stage 1. So in this stage, we have the systolic blood pressure ranging from 140 mmHg to 159 mmHg, and the diastolic blood pressure ranging from 90 to 99 mmHg. So in the third type of hypertension, that is the hypertensive stage 2, we have the systolic blood pressure being equal or more than 160 mmHg, and the diastolic blood pressure being equal or more than 100 mmHg. So the last one is the pregnancy-induced hypertension. So when a woman is in her gestation period, that's when she's pregnant, she tends to have high blood pressure. So this is pregnancy-induced high blood pressure or hypertension. So the next thing I'm going to be talking about is the etiology. The etiology, when we say the etiology, we mean the causes. So there are 2 causes of hypertension. We have the primary causes and the secondary causes, or you can say the primary hypertension and the secondary hypertension. So when we talk about the primary hypertension, we do not know the cause of this type of hypertension. We don't know what causes it. We don't know where it came from. It just happens. And then when we talk about the secondary one, it comes from different causes, ranging from family history, from lifestyle, if the patient has underlying sicknesses. So if the patient has underlying medical problems like diabetes mellitus or congenital narrowing of the arteries, that's when we say congenital during birth, and so on. So risk factors, when we say risk factors, like what are the things that are liable to cause hypertension? The first and foremost one is the age. So people ranging from 50 upwards tend to have hypertension because of the age. They have a lot of things on their mind, thinking about how they will die and leave their children, what are they going to leave it for, all of those things, financial problems, societal problems, everything like that. So the next one is alcohol or drinking. That comes under lifestyle. So when we talk about lifestyle, if the person drinks, the person smokes, so the person is liable to have hypertension. Another one is excessive dietary intake of sodium. So if you tend to take a lot of sodium, so that person is actually liable to having hypertension. You know that our parents would say, don't consume a lot of salt, don't consume a lot of salt. So I'll just say that it falls under this category. So the next one is gender. So I know people will be like, oh, gender, yes. According to research, females are more liable to have hypertension than men because they have a lot of things going on their tables. Their mothers, some of them are full-time housewives. They have house chores to do, so they've got a lot of thinking to do. So the next one is family history. When we talk about family history, we're talking about, this is where genetics comes in. This is where you go back to asking your father if he had or if he has hypertension, or his father had hypertension. And then the last one is obesity. People tend to like neglect their weight. They tend to consume anything that comes their way, and they just think they'll get away with it. So consuming a lot of fat can lead to obesity, and obesity can lead to high blood pressure, and it can lead to myocardial infarction. And then we have nausea, so vomiting, dizziness. Some people tend to misunderstand or mistake nausea with vomiting. When you're feeling nauseous, it's different from when you want to vomit. So when you're feeling nauseous, you get irritated easily. Anything just irritates you, and then you feel like vomiting. So it's like a process. Fatigue and dizziness. The patient tends to get tired easily from just not doing anything, and then they become dizzy. They have blurred vision, and then they eventually become dizzy. Medical evaluation. So the first one is history collection and physical evaluation. So you ask the patient, okay, what's your name, where are you from, when did you start, the medical history and all of that. And then the physical evaluation, touching the chest to see if the patient feels the pain over the chest, over the back, if their body parts are paining them, or if they have headaches. And then we have family history. That's when you ask, okay, does your father have hypertension, or does your mother have hypertension? And then we have ECG. So ECG is electrocardiography. So it is a process in which the electrical processes that are going on in the chest are looked up to in a machine, in an ECG machine. So you see how the electrical conduction of the heart is going through, how the blood is being passed within the arteries, and that's where you detect if there's pressure within the arteries of the heart. So the last one is the chest x-ray. So you just go take the x-rays of the chest and see if the heart is in a good condition. So that's all about the evaluation. So the last thing I'll be talking about here is management. Management of hypertension. There are two main ways hypertension can be managed. The first one is lifestyle management and the pharmacological management. So when we talk about the lifestyle management, this is where weight loss comes in case of obesity. This is when we change diet of the patient. There's something called DASH, dietary approaches to maintaining hypertension. So that is DASH diet. You recommend DASH diet to your patient. A nutritionist so prescribes the kind of food that gets consumed by the patient. And then we have exercises. So this is where the role of a physiotherapist like me comes in when it comes to physical activities, isometric training, and all of that. So a physiotherapist comes and teaches strengthening exercises, relaxation techniques, isometric exercises that will help the patient in managing the pressure that goes on within the arteries of their heart. The second way of managing hypertension is the pharmacological way. This is where medically, like we have medical doctors prescribe medicines for hypertensive patients. The medicine can be beta blockers, alpha blockers, we have diuretics, and so on. So talking about the physiotherapy management in details, because I'm a physiotherapist, So that is my specialty. So when you want to manage an hypertensive patient as a physiotherapy, you have to go through 3 stages. So you teach the patient endurance training, resistance training, and isometric training. So in endurance training, you teach the patient how to endure for a longer period of time than they used to do. For example, while running. So let's say the patient usually runs for a minute and they stop. As a physiotherapist, what you do is you teach them how to endure for while running for at least maybe like from 1 to 2, from 2 to 3 gradually. So the reason for that is because endurance training help them endure longer than they used to do. So it will help them manage the pressure within the arteries of their heart. So the second one is resistance training. Okay, I know from the word resistance, yeah, you teach. So when we talk about resistance training, so strengthening exercises are under resistance training. So strengthening exercises are used in managing BP due to the muscle contraction and relaxation. The more the muscles contract and they relax, the more you are able to manage the pressures within the arteries. And then the last one is isometric training, weightlifting, maybe like biceps, and then push-ups. So those ones to help in managing blood pressure, thereby maintaining the weight of the patient and avoiding obesity, thereby managing high blood pressure. So I've come to the end of this discussion with you guys. I'm very glad that I'm able to be on this channel. I'm so happy that I'm able to like have little or more impact on your lives. And again, my name is Fatima Goni, and I'm an aspiring physiotherapist. So I'd like to see you guys next time. So stay tuned and make sure to tune in whenever PhysioNet drop new videos. I'll see you guys. Make sure you remain healthy and manage yourselves. Bye bye.